As a staff member of the recreational sports team, you should always be prepared to deal with a variety of injuries and emergency situations. This simulation shows a proper response to a first aid situation and how to provide appropriate care.
Excuse me, do you guys have any Band-Aids? I kind of slipped and fell and cut my hands up.
Yeah, certainly. It looks like you might need more than a Band-Aid. My name's Jordan. I'm first aid certified. Do you mind if I take a look?
Yeah, go ahead.
Are you lightheaded? Feeling
No.
sick to your stomach?
No, I'm fine, just my hands hurt.
Okay. I'm going to grab the first aid kit. I'm going to be right around. You still feeling okay?
Yeah, I'm fine, just my hands.
All right, I'm going to put my gloves on and we'll take a closer look. So how did this happen?
I just slipped and fell on the curb.
Okay. Alright. Yeah, it looks like we might need to go wash these out. There's a little sand and gravel in here, so we want to make sure we rinse them out really good, alright?
Alright.
Alright, are you still doing alright?
Yeah, I'm fine.
Alright. Alright, we'll use this sink right here. I'm just going to turn some water on for you, and let's irrigate that out first. And then we can get some soap on it. So why don't you rinse your hands out good there.
It is important to clean and irrigate most soft tissue injuries, such as cuts, scrapes, and abrasions, in order to prevent infection and remove foreign material.
And I'll get the water here, and then I'll help you dry your hands.
Pat the wound dry, and be sure not to scrape the area in order to avoid causing severe bleeding.
Does that hurt?
Yeah, well, it stings a little bit, but it's fine, yeah.
Always talk with and keep an eye on the person and look for unusual signs and symptoms that may develop.
All right, we'll take you back out here, and then we'll get you wrapped up, all right? All right. All right, we're gonna grab a seat right here at this bench.
All right.
I'll have you sit down right here. And are you still feeling all right? You're not
Yeah.
lightheaded?
No, I'm good.
All right. Jordan, to the front desk.
Front desk, go ahead.
Could you bring a transportation slip and an injury report? We're over by the south entrance to the building.
Yes, on my way.
Thank you.
Hey, Jordan.
How's it going, Marcus?
Good, how are you?
Good.
Alright, so while he's going to bandage you up, I'm going to kind of explain some things that we have here. Alright, so this first document is a transportation slip.
Be sure to walk through the transportation form, providing information in case the person develops further symptoms or pain. This form also lists local transportation agencies and their phone numbers, plus it includes directions to 2 local hospitals.
We want you to contact these places and these transportation services to get extra care, okay? Alright. And then next is an injury report, and I'm just going to kind of ask you some questions just to fill it out so we have it on record and we can follow up with you.
Does that feel good? That's not too tight?
No, yeah, it's
But
good.
it's snug?
Yeah, it's good.
Okay.
We have a local
Begin
address.
completing the injury report while the person is
yeah.
still present,
And then
making
a
sure to
phone
gain
number
as
that we
much
can reach
information
you.
as possible concerning the event
Did
and
you
the
come here with
injury.
a friend or anything? No, I didn't. I was just walking from class. Gotcha. Is there someone we could call that could maybe walk you home?
It is
Yeah,
always
I have a
preferred and
friend.
encouraged that the person leaves with a friend, a medical service provider, or the university police, depending on the severity of the situation.
Dude, buddy, what happened? What are you doing?
Just cut him up.
Doing what?
I just fell on the sidewalk.
Alright, well, you need to go to the hospital or you just want to go back home?
I'll be fine. They just want someone to walk me home.
Okay,
so.
sounds good. We can go, man. I'll take you.
Cool. Alright, so here's an injury transportation slip, and there's just some numbers for local hospitals, health
Okay.
centers, as well as some cab services and transportation services.
Excellent.
So if anything gets worse with him, make sure he gets to another healthcare provider.
Perfect.
Okay?
We'll do it. Thank you.
Yep. Alright.
Let's get out of here.
Alright.
You good, buddy?
Yeah.
Use an appropriate disinfectant to wipe up any blood or residue that may be in the sink and surrounding areas. If nothing is saturated with blood, materials may be discarded in the trash. Any items soaked with blood or bodily fluids should be placed in a biohazard bag and taken to the biohazard container in the first aid pod. Once everything is cleaned and disinfected, finish completing and submit the injury report to Mo. Then return to work at your service area.